Hello everyone. I welcome you to the video on parts of nitrous oxide conscious sedation unit. The nitrous oxide conscious sedation, which is also popularly known as the laughing gas therapy, has become the preferred mode of treatment for anxious patients in the dental field. It is a very predictable modality that minimizes pain, or I can even say it eliminates pain in pediatric patients. And not just pediatric patients, even anxious patients can be treated under this modality. And all that with very minimal risks. Several equipments have been designed to deliver nitrous oxide oxygen mixture to achieve relative analgesia. Some of these work as demand flow units, while some work as continuous flow units. The unit you see in the picture works as a continuous flow unit, meaning it delivers the gas continuously as per the rate and the volume determined by the operator. On the other hand, the demand flow units, they adjust the flow and pressure according to the patient's breathing needs. Coming on to the parts of the unit, the first one is the yoke assembly, which you see in picture. It is a metal framework to which the cylinders are attached by means of metal pins. The components of this yoke assembly include the sealing washer, which is indicated now. Next is the port for the gas. The metal pins to which the cylinders are attached is shown. And finally, the thread for the cylinder. I have to say that this unit comes with a lot of safety systems, and one such system is the pin index safety system. This is a highly efficient unit of pins and holes, which is present, the holes is present on the cylinders and the pins in the yoke assembly. I'm sure you're able to appreciate the holes on both the cylinders. The holes on the oxygen cylinder, which is indicated by white arrow, is bigger than that on the nitrous oxide, indicated by the blue. The holes on the oxygen cylinder are bigger, which ensures that there is never the wrong cylinder placement. Next component are the cylinders. You have two cylinders, one for oxygen and one for nitrous oxide. The nitrous oxide is the blue one and the oxygen is the white one. So for trained personnels, they never confuse between the gases because of this color code. Not only the cylinders, the connecting tubes are also color coded, making it easy for anybody to identify. The next safety system is the diameter index safety system. So here we see that the tubes coming from the cylinders are connected to the flow meter, and this standardized connection ensures that there is never a mix-up of gases, because each gas line has or comes in different sizes. This is the flow meter, which is highly calibrated and placed above the yoke assembly in the front part of the machine. This has two glass tubes which are indicated by the double side arrow. One is for oxygen and one is for nitrous oxide. Both are color coded, white for oxygen, white or green for oxygen, and as always blue for nitrous oxide. So you see the small mercury ball at the bottom of the glass tube. This indicates the flow of the gas by its rise and fall. This is the knob which is used to control the flow of oxygen. You can increase or decrease the oxygen, and this knob is used to control the concentration of nitrous oxide. Here you have the oxygen flush button. This actually serves as an additional source of oxygen when the reservoir bag is inadequate or when the gas flow decreases. The pressure gauge indicates the level of oxygen and nitrous oxide. It is 2000 for a full capacity oxygen cylinder and 800 for a full capacity nitrous oxide cylinder. The bag T holds the reservoir bag. The reservoir bag actually has three purposes. It serves as an additional source of gas. You're able to monitor the breathing of the patient under sedation by observing its expansion and contraction. And it also serves as a positive pressure oxygen source in case of an emergency. This is the additional inlet for air, which works when the gas flow is cut off. So you have the conduction tube, which delivers oxygen from the unit to the patient, and the other tube is connected to the suction unit. The suction unit scavenges the expired air to the external environment, thereby controlling the concentration of nitrous oxide in the operatory. This is a very important system which helps to keep the nitrous oxide in the operatory in check. And here we have the nasal hood or the masks. There are two types. One is the autoclavable one, which has an outer mask and inner lining with a scavenging hole. The other one is a single piece and is a disposable mask. In addition to a lot of safety systems, the flow meter also ensures oxygen fail safety, whereby when the oxygen level drops below 30%, the flow of nitrous oxide is automatically cut off, ensuring that there is never 100% nitrous oxide administered to the patient. So that's all about the parts of the conscious sedation unit. I hope you find this video useful. Thank you.